Alright, so let's begin the show. PM Modi announced the launch of the much-awaited Ayushman Bharat health insurance for all senior citizens age 70 or above, regardless of economic status. Now, these senior citizens will be eligible for free medical treatment up to Rs 5 lakh under the scheme. The only eligibility criteria is that the individual must be age 17 years or above, as determined by the age recorded in their Aadhaar card, regardless of economic status. Now, one thing that you have to note is Aadhaar-based eKYC is mandatory for the enrollment and issuance of Ayushman cards for eligible senior citizens. Aadhaar is the only document needed for enrollment in the ABPMJY senior citizen scheme. Ayushman Vaya Vandana card is what we are talking about over here. Now, this card is universal and there is no restriction on income, be it poor or middle class or upper class. Every senior citizen above the age of 70 will receive free treatment in hospitals. Now, these senior citizens will be issued the Ayushman Vaya Vandana card. Now, how do you avail this particular card, and how can you avail this on mobile as per the National Health Authority website? Let's understand all of this, the importance of this particular card and the kind of coverage that we are talking about under this scheme. I have with me Pankaj Mathpal, MD of Optima Money Managers. Pankaj, good evening and welcome to the show. So much awaited. Again, we were waiting for the enrollment of Ayushman Bharat scheme, and now we also have a Vandana card through which you can enroll. So the importance of this card and how can you enroll for it, Pankaj?
Kavita, good evening. See, the earlier Ayushman card was only available for category means where below poverty line. But now this Vaya Vandana card is available for every senior citizen who is 70 years or above. So, irrespective of your financial status, you can enroll for this. And procedure is very simple. Through app or through the website, you can enroll for it. And only one document, that is your Aadhaar card, is required for this. So, through Aadhaar card, you enroll for this, you get OTP, and you just input that OTP and you are okay for it. So, process is simple, but yes, initially some glitches, sometime like there are complaints that OTP is not being delivered on time, it is taking time, or especially in Maharashtra because of elections, right now enrollments are suspended. So this kind of problems may be faced by some individuals. Otherwise, it's a very seamless process, and one can try. If you are not getting OTP immediately, after some time again you try and you'll be able to receive that.
So all this can be done on your mobile. This enrollment, are we talking about being done on mobile, digitally, online? That is how it's going to happen, Pankaj?
Yes, through your mobile phone or through the website, you can process this. And the process is simple, as I said, whether you go through the app or you go through the website, simply means you have to input your details, your Aadhaar number, and this is the only process. Rest, all the information are passed through your Aadhaar card.
Pankaj, what will be the criteria for Ayushman Vaya Vandana card, and also what is the eligibility criteria for this entire scheme? We know that senior citizen 70 and above are available for free medical treatments, and the sum assured is almost around 5 lakhs. But any more details or any new addition in this entire scheme that our viewers need to know? And free treatment in what kind of hospitals, and what kind of free treatments are we talking about? If you could just deep dive in the basic feature of the coverage that one gets under Ayushman Bharat.
Yeah, see, first thing, if suppose you are already enrolled for this under the family, means because already you are under that category and you have Ayushman Bharat card. Now, because it's an additional benefit, so in that case, what 5 lakh was already available for the family, you can top up over and above that. Suppose parents are senior citizens. So, for example, parents are senior citizens. Along with that, there are children in the family, and total amount was 5 lakh earlier. Now, 5 lakh will be divided, or means it is shared among the family members. But in addition to this, senior citizens parents who are 70 years and above can top up that amount. So it may be that 5 lakh additional in the family for senior citizen parents who are 70 years and above, and additional 5 lakh is already available, which can be shared by senior citizen parents as well as by other members in the family. So that is one important thing. Second important thing, Kavita, if you have your private insurance, suppose you are covered under any health insurance policy, or for example, you are central government employee and you are covered under CGAS scheme or any other state government scheme, even then you can register for this, you can enroll for this Ayushman Bharat card. Only thing you have to remember, if suppose you opt for this and you want to exit from your CGAS scheme, Miss central government scheme, or you want to exit from the state government benefits, in that case, you cannot go back to that. So if you are already covered by any other government scheme, in that case, again, you can enroll for this, but then you have to remember this, that only you will be covered by this Ayushman Bharat Vaya Vandana Yojana and not by that government scheme where you were covered earlier. So you have to decide which is more beneficial for you.
Pankaj, along with Ayushman Bharat, do you think it's important for one to have other kind of coverage also?
See, definitely, because cover is only 5 lakh, and as we understand, as the age increases, there are more chances that you come across the diabetes or hypertension or this kind of age-related uh, disease. So considering that fact, if you have additional cover, that is always better. But Kavita, see, we know that premium is very high when the age is 70 years and above. So in such case, at least this 5 lakh cover, what is available, that will be very helpful. In addition to this, you may have your some additional amount available with you, not insurance, but I mean that some healthcare kitty that should be available. But yes, if possible, you should also try to get additional health cover, health insurance policy you can buy.
Pankaj, under Ayushman Bharat coverage, are there any limitations also that one needs to consider? Limitations or restriction that might not be covered, just to avoid last minute shocks?
Yeah, very good point. I missed it actually to mention. Kavita, here the best part is right on the day when you enroll for this same day, you are eligible for cover. Means your cover starts immediately. You do not have any cooling off period. So on and all disease, even it's not like any pre-existing disease will not be covered under this. So any day when you enroll for this, immediately your cover starts for existing disease or any disease which is diagnosed later. So that is the best part with this scheme.
All right, Pankaj, I think all the important points have been highlighted and covered. And just in case any viewer wants to know more about the Ayushman Vaya Vandana card, they can send across their questions on our WhatsApp number and email ID. But it's time for a quick break. Post that, we still have Pankaj connected and he'll be doing our viewers' live financial planning. But before I go on to the break, I'm going to leave you with our WhatsApp number and email ID. Post that, we'll be answering your mutual fund portfolio queries. Answer.
If you like this video, then like, share and subscribe to ET Now.